Very good morning. After a very good banquet, we are now, most of us, in the bed. So, thank you, the few who are here. So, my topic is avoidable corneal blindness and overview. I don't have any financial interest on these things. So, WHO study by Lancet and Globe in 2021. Globally, there are 2.2 billion people of vision impairment, and India has become the world's largest number of blind people now. The study from 18.7 million to it has come to 31.6 million by 2020. So by the recent study of 2015 to 2019 in this part, the corneal opacity 7.4% in patients more than 50 years and 37.5% in aged 0 to 49 years. So in most of the cases, the corneal blind are increasing day by day, and mostly they are common in first to second decade of life. As per the survey, the total corneal blindness, the refractive error, cataract, along with it, the total corneal blindness has increased to 8.2%. That is the most significant part of it. So by gender, females are more affected in these cases. The causes, as per the situation, it may be infectious, nutritional, inherited, trauma, iatrogenic. We don't have to go to that theoretical aspect. So mostly in trachoma, xerophthalmia, measles, neonatal ophthalmia, leprosy, and corneal trauma in agriculture work, the corneal blindness increases. So childhood by blindness is little more, which we have to emphasis on that, because 25% is due to cornea. It can have a developmental or educational and future job opportunity, and quality of life is hampered in case of children. So most of the corneal causes, as we have to deal with, infectious. It can be bacterial, viral, fungal, or acanthovial, any infective causes which silently kills the cornea. So here is the most important point which we want to emphasize on this social background, that poverty, illiteracy, and rural areas where they do not have the corneal surgeon to treat, tropical climates, trauma most common in as per the agricultural part, misuse of steroids and eye drops, because that is cheaply available with generic name and all those things. With 10 rupees a drug is available, and most of the time the chemist used to give a steroid drop which gives a very good result. And most important is the traditional methods, either putting the honey or any juice or mother's milk, any other things can cause some problem in the cornea. So poverty, as usual, it is the most common cause. We use these common homemade things, either from honey or milk or any other thing which causes the corneal to do. Trachoma, this is one of the most common causes still prevailing in India. Though we do not see much cases, but it is still there rampant. So treatment of trachoma goes either with surgery or antibiotics or facial cleanliness or environmental changes. The safe method is important. This is the leprosy. Most important is in case of vitamin A deficiency or xerophthalmia. The massive dose implementation is very easy, but fortification and common foodstuffs with vitamin A, immunization, control, and prescribe precipitating infections and dietary improvement to combat that public health problem is effectively needed. Blindness due to vitamin A deficiency, as we have common corneal xerosis, keratomalacia, corneal scarring, all these things are important. Xerophthalmia treatment, when we go for vitamin A deficiency and we do have the doses less than 6 months, 6 to 12 months, more than 12 months, 50,000 units or 1 lakh units we have to go in the next 2-3 days. Proper treatment, rehydration, and sometimes when you are teaching in case of vitamin A deficiency, most of the patient with malnutrition and diarrhea. So when we treat the diarrhea cases, most of the general physician, they forget about the eye condition. That is the most important part one should remember, because while treating the general conditions, if you just put a drop into the eye, that will save the eye, and the general condition improves of the patient and the eye goes back. So children with blinding xerophthalmia are often severely ill. Proper treatment will save their sight. So most important then comes through us is trauma. We are very happy to enjoy the Diwali is coming, and once Diwali comes, again we do suffer from these corneal causes. It can, workplace injury are very common in these patients. Chemical injury, we don't have to signify on the certification. So prevention, eye safety at work, copious irrigation, because there had been a alkaline injury due to a balloon blast in case of Bhubaneswar while I was a house surgeon at that time, nearly 30 years back. That cost till us almost 100 crores, because these 15 people are roaming from all over India, from this hospital to that hospital, just because it has not been irrigated. There is no, it was in a flag hosting day, no water was available, and whenever they reached the SCB Medical College Cuttack, it was already 6 to 8 hours, and in between nobody has irrigated the things. 1 minute, ma'am. So corneal dystrophy as usual is very common. I don't have to go to, contact lens users are most common causes of this. So either you can, so NPCB guidelines strengthening the advocacy, reduction of the disease burden and human resources. So general strategy, identification and infants, preschool children, these are the essential supply of drugs. To eliminate the corneal blindness, multi-program studies needs to be developed. Control preventable causes requires extensive public contact. Curable and treatable blindness requires a spectrum of care. So our vision is social impact, affordability, quality and accessibility. So just take home messages. Corneal blindness ends with mostly corneal opacity. So solution of corneal transplantation is there. So better take care of the corneal transplantation program, eye banking program, but prevention is better than cure. So although when what's a corneal opacity comes, eye donation plays an important role. So thank you very much for present hearing. Thank you, ma'am.
Thank you very much.
Yeah.
Sir, you have covered everything about
Oh, yeah.
cornea in 7 minutes, I would say, because
Thank you, madam. Madam, it is now time for you. Thank you. Thank you.
any questions?
Yeah, anything you can ask.
Questions for sir?
No. Thank you. I think they have understood totally or they have not understood anything. Either the two
No,
conditions.
you were
Thank you.
very clear. Thank you so much.
Thank you.